in the medical history. Are you aware, have you ever been told of any complications you had during your birth? Okay, so with your, I guess, development as a child, did you, from what you know, crawl, walk, talk and everything normally?
Yeah, I think so.
Okay. So from the point of your birth until now in your life, have you ever suffered any sort of like concussion or head injury, loss of consciousness?
Yeah.
Okay, can you tell me a little bit more about that?
I mean, I've got my ass beat quite a few times, so
Okay.
we'll just leave it at that.
Okay, and did you recover just fine? Do you have any lasting damage after that occurred?
Sometimes I just get these pounding headaches, but that's about it, I'd say. Got some nasty scars, but.
All right. So currently now for the present day, are you currently being treated for any sort of physical injuries or illness? And oh no, okay. And so are you on any current prescription medications? Okay. And so have you ever had a seizure or suffered from a blackout?
No.
All right. And is there anything else about your personal physical medical history that you feel like I need to know?
No.
Okay. So, okay, this next subject could be a little bit hard for some clients. I just want you to feel comfortable talking to me in this setting and know, and just also remember how I discussed the limits and the bounds of confidentiality. So have you ever in your life from birth until now, to your knowledge, been physically abused?
No.
Okay. Have you ever experienced any sexual abuse?
No.
Okay. And do you recall ever having been emotionally abused?
No, not by my parents.
Okay, but maybe by someone else?
I don't know. I had this guy I worked with for a while who, he just used to do these things that got under my skin, and he knew it did. It just got me to do things that I wouldn't normally do. But.
Okay. Do you feel comfortable sharing any more of that experience with me?
I mean, there's nothing really specific about it. It's just like, just little things. Just little things he used to say to kind of manipulate me, but that's about it.
Okay, and some of these things, as you said, that he would kind of get you to do, could you tell me more about that?
Just like petty, like work-related stuff.
Okay.
Nothing too extreme.
Okay. Okay, and this was the same job you told me that you had prior for the 5-year stint?
Yeah.
Okay. All right. So have you, or do you currently use cigarettes or any other sort of substance, like maybe marijuana, cocaine, opioids, anything like that?
Yeah, I smoke cigarettes.
Okay, and when did you start that?
When I was 15.
Okay. All right, and when was the last time you smoked a cigarette?
Oh, right before I walked in your office.
Okay. And how frequently do you typically smoke?
I'd say about half a pack a day.
All right. And has there ever been any period where you've went without smoking cigarettes, and if so, how long was that period?
I went about 4 months one time.
All right. And when was that? Or do you recall?
That was about 8 months ago.
Okay. And what about other forms of substances like marijuana, cocaine, opioids, hallucinogens, any sedatives?
Things I do now?
Mm-hmm. Or anything in the past?
Well, I do smoke marijuana.
All right.
I'd say maybe 3 or 4 times a week.
Okay. And whenever you do, how much do you typically smoke?
Let's just take an estimate here. Say about 2 grams each time.
Okay. And when's the last time you smoked marijuana, and around the time did you start smoking marijuana?
I'd say I actually started smoking marijuana before I started smoking cigarettes, about 13.
Okay.
But, what was your other question?
When was the last time you smoked?
Oh, like 2 days ago.
Okay. And just with I asked about cigarettes, has there ever been any period of time where you've not smoked marijuana, and if so, how long was that period?
Yeah, about 4 months ago again, or yeah, for 4 months, 8 months ago, and then a little while in rehab. I think that was like 3 months.
Okay. So what about alcohol? Do you currently, or have you drank in the past?
I mean, I do, but not too much. I wouldn't say it's a problem.
Would you say it's less frequent than how much you smoke?
Oh, yeah,
cigarettes and
definitely.
marijuana? Okay, and around what age do you recall that you started drinking?
16, probably.
Okay. And has there been also a period of time where you've abstained?
I mean, well, rehab, obviously, but other than that, no. Just not frequent use.
Okay. And then, even though it hasn't been frequent, when was around the last time that you've drank?
I think I went out with my buddies about 3 weeks ago.
Okay. All right. And just for, I guess, the rest of the, substance abuse, or not substance abuse. I'm going to edit that part out. Just for some other substances, has there been anything else that you've taken in the past, like opioids, anything non-prescription, or prescriptions that hadn't been prescribed to you?
Yeah, methamphetamine for a good while there.
Okay, can you tell me a little bit more about that?
I mean, I don't know how much else there is to say. I just one of those things my friends and I did all the time, like every day for a while there. I've been off that for about a year now.
Okay, and so you said you do it with your friends. Around what time did you start that? Do you recall?
Maybe I was like 18 or 19.
Okay, and so it's been about a year and a half, and whenever you would, do meth with your friends, would it be pretty frequent?
Oh, yeah.
Okay. All right. So currently, I guess or in the past, but mainly currently, have you experienced any problems associated with any of your substance use? Familial problems, work-related problems, any financial, legal, driving problems, anything like that? Any way it's impeded in your life in a negative way?
I mean, yeah, I feel like in all those aspects, I don't even know where to begin. Just definitely, to answer your question.
Okay. So you feel like it's just been a large impediment, you'd say?
Oh, yeah.
Okay, and I know you said, you mentioned prior that you've had a point where you went off to rehab.
Mm-hmm.
So can you tell me a little bit more about that experience and what exactly was the treatment for?
It was for methamphetamine. It was an interesting place. I mean, I did it, and I stayed clean for about 3 months after that.
Okay. Okay, and what did you think of the whole experience? How did you respond to treatment? Do you think it went well?
I'd say overall, yeah.
Okay, well that's good. And was that the only time you've been in a rehab type facility?
Yeah.
Okay. And then did you go there on your own will, or was it court ordered?
No, my friend encouraged me to do it.
Okay. Well, I'm happy to hear that you've been clean. Okay. So, I guess related to that, do you have any current charges, legal charges, out on you, or do you have any past history of criminal offenses?
Yes to past history. no to current charges.